My name is Werner van Straaten. I'm one of the radiologists here at Smit and Partners. My area is body and neuro-intervention. My sort of special interest is neurovascular interventional procedures. Started off doing body intervention and saw that I wouldn't do neuro because it was a bit intimidating and a bit scary, to be honest. And during my training, the team in Bloemfontein did both body and neuro, and after about a year they asked me to also sort of start doing the training in the neuro, and it kind of broke me down, and so I started doing it there, and I haven't looked back. During my registrar training I was exposed to Dr Duncan Royston, who's one of the partners here at Smit, who came across to Lutuli and where I was doing my registrar training, and did sessions there, and I saw him do some really amazing work. Initially I thought it was a bit, too challenging for sort of a normal person to attempt, but after doing a year of body intervention training at Bloemfontein, they asked me to start doing the neuro as well, and it turns out it is within the grasp of normal people. So it has been one of the great privileges is to come work at Smit with Duncan, the man kind of who inspired me to pursue this career in the first place. It's a field that's growing very rapidly, and more diseases are being tackled, and the ones we have been tackling, we are able to tackle them better. Some of the more exciting advancements are sort of the rapid progression of stroke treatment. It seems like every 6 months there's a new tool to get harder clots out, more difficult to sort of reach places. You can help more and more people. And also in the treatment of cerebral vascular malformations, there are new techniques and new equipment out to tackle things which were before completely untreatable. We can actually cure now, which is very exciting. And sort of in the last 10 years or so, probably the biggest step forward has been acute stroke treatment, where before you could get only the clot busting drug, which worked very well for small blockages but was not very effective for big blockages. These new techniques, which only really started being accepted in about 2015, have completely changed the game, and subsequently there's been a huge boom in research in acute stroke treatment, and that's really the knock-ons have been not just in our treatment but in the rehabilitation and understanding of the disease has really just exploded in the last 10 years. So that's really probably been the biggest impact that we've had in patient care. So the training part, I followed a very South African way of training, where it wasn't very formalized. It was sort of on-the-job training under people who are very competent and capable, and I did that for a period of 2 or 3 years. There were a couple of academic courses I did to shore up the knowledge, along with the practical exposure. Since I've joined private practice, I've done between 400 and 500 cases here at Smit. It is quite an amazing feeling. Many of our patients arrive in some form of extremis. They have either had a brain bleed or have had an acute stroke, blockage in the brain, and they're quite debilitated. And if you can nurse them through that process, treat the condition, get them home in a couple of weeks, and they're sometimes sort of they have no issues at all. That's an amazing feeling when they come out the other side, in perfect health. So with brain aneurysms, it's not that recent, but we have these special stents called flow diverting stents, which make 10 years ago these things would be completely untreatable, and now it's basically simply placing a stent across the aneurysm, and that sort of treats it. In terms of the stroke treatment, I think I mentioned earlier, it feels like every 6 months there's a new device, but pretty much everything we have, just from the time I started doing it, is much better. The guide catheters to get you to the vessel, much better. The aspiration catheters to suck out the clots, you can get them much deeper, much safer. The stents are also improving to remove the clots. So everything is just the industry's really come to the party, and every couple of months there's a new toy for us to figure out its role in treatment. We are pretty good at we have very open lines of communication, and if there's a new thing that comes from their side, they readily communicate it to me, and I do the same. And each patient, we have prior discussions about how best to treat certain conditions, and there's certain things that they need to deal with and other things that I need to deal with, and we kind of know where the lines are. But I'm on the phone with the neurologists pretty much every day, and the same with the neurosurgeon. So the key is the open lines of communication between us. Endovascular intervention is basically one of two things. You're either opening something up or you're closing something, and that's all we do. It's just plumbing. In terms of opening things up, that'll be a role for stroke treatment, where there's a blockage in the brain, and we go and unblock that artery. Every other thing is the vascular malformations are these abnormal vessels that tangle the vessels in the brain, and we go and close that off to prevent it from bleeding or causing seizures. The aneurysms, we basically close those little aneurysms with coils and stents and things. And then there's a few other preoperative embolizations of tumors we sometimes perform for the neurosurgeons to help prevent bleeding in the procedure. And there's a slightly newer treatment called dural sinus stent placement, and that's for a condition called idiopathic intracranial hypertension that's been underdiagnosed for several decades, and it's usually suffered by young ladies, and they have sort of constant headaches and they have ringing in the ears, and there are a group of them who respond very well to stenting of one of the veins, which is narrowed in the back of the skull, and that also has the ability to radically change someone's quality of life. I think the simplest thing would be to make an appointment and come and see one of us, and we'll talk you through everything. It's a very difficult thing to wrap your head around just by reading online or stuff like that, because each case is slightly unique, and what is appropriate for one person is not necessarily appropriate for the other person, and the risks and the complications are sometimes vastly different.